A good day to all of you. Shall we discuss polycystic ovarian syndrome today? PCOS or polycystic ovarian syndrome literally means many, poly means many, cis means fluid-filled bubbles or blisters, ovarian is anything related to the ovary, and syndrome is a collection of signs and symptoms unique to a particular disease. So polycystic ovarian syndrome literally means many cysts found on the ovary, and this is associated with a group of signs and symptoms. There is a lot of fear associated with PCOS, and this is likely because we do not understand the pathophysiology or what happens within the human body in PCOS. So generally what happens in PCOS is that there is a lot of hormonal imbalance. In order to understand the hormonal imbalance, shall we quickly look at what normal hormonal balance is? So during a menstrual cycle, all the hormone levels related to the female are at base level. So when the hormone levels are low, the brain senses this. So there's a structure called the hypothalamus in the brain, which sends signals to the pituitary. So the pituitary initially sends signals called FSH, stands for follicle stimulating hormone, to the ovary. So under the influence of FSH, the ovary recruits about 10 to 12 follicles, which are sleeping eggs from the ovary. There are millions of eggs in each ovary. So each month about 10 to 12 eggs are recruited, out of which one reaches dominance, which we call the dominant follicle, which is going to produce the egg that particular month. So the growing follicle produces a hormone called estrogen. Estrogen has two main functions. One is that it causes thickening of the lining of the endometrial cavity. The second, the rising estrogen levels sends signals to the pituitary. So in response to this, a switch in the pituitary happens in that it stops producing FSH and produces a hormone called LH, which is luteinizing hormone. Under the influence of luteinizing hormone, the egg recruited follicle matures, and the matured egg is released from the follicle. The released egg produces a hormone called progesterone. Progesterone in turn does two other functions too. One is that it causes further cushioning of the already thickened endometrium within the uterine cavity. The second is that it sends signals to the brain to say there's enough progesterone, and therefore the pituitary stops producing LH. So if a pregnancy happens, the progesterone levels remain high, which is produced by a structure called a corpus luteum, which is a remnant of the released egg, and therefore pregnancy continues. If a pregnancy does not happen, then the hormone levels fall and a menstrual period happens. So this is what happens normally every month in a woman's body. So what is the difference in PCOS? In PCOS, the initial start of the cycle is exactly the same. At base level, the hypothalamus sends signals to the pituitary. The pituitary sends FSH signals to the ovary. The ovary starts recruiting about 10 to 12 eggs. Hereafter, the difference happens in PCOS. The 10 to 12 eggs compete among themselves, but none of them reach maturity. So there is a lot of estrogen because all the competing follicles produce estrogen. So there is a thickening of the lining of the endometrial cavity. However, as none of the follicles reach maturity, there is no progesterone. So the brain senses that there's no progesterone, so produces a lot of LH. So the level of LH in women with PCOS is high. So LH does two things in that it causes an increase in production of the male hormone, which is androgens, within in women with PCOS. So in a gist, what happens in women with PCOS is that the FSH levels are normal or low, LH levels are high, androgen levels are high, and there's no progesterone. And because there's no progesterone, the menstrual cycles do not happen. And this is the reason for irregular menstrual periods in patients presenting with PCOS. The second is there is no egg released, right? We've seen that already. And therefore, subfertility is an issue because for a pregnancy to happen, it's important to have an egg, but there's no egg production in PCOS. The third issue is there's a lot of androgens. And androgen, as we saw already, is a male hormone. And as a result of which, people with PCOS have oily skin, spotty skin or acne or pimples. And they have male hair distribution in that there's a growth of abnormal hair in the upper lip, chin, chest, abdomen, lower back, etc. In addition, there is loss of hair from the front part of the scalp, which is called male pattern balding. So all these are this is the hormonal changes and the effects of the hormonal changes that happens in patients with PCOS. So one common question asked by mothers who bring their daughters to the clinic is that why is there increased incidence of PCOS these days? This wasn't the case in my generation or in my mother's generation. Unfortunately, the answer is rising obesity. PCOS maybe have been an underlying problem, but it wasn't a clinical presentation or causing symptoms because the body mass index was normal. So with the rise in obesity, the rise in the body mass index, the underlying PCOS becomes manifest. So what is the treatment options for PCOS? Unfortunately, there is no one definitive treatment apart from the most important bit is of maintaining a normal body mass index, which is below 25 for the rest of the world, but for Southeast Asians, it has to be less than 23. This weight loss or maintaining a BMI is known to eradicate the symptoms associated with PCOS. Fertility may still be an issue, but management of fertility becomes easier or better. Outcomes are possible with a normal body mass index in any fertility issue for that matter. So the treatment is aimed towards the presenting complaint of the patient. So if the patient is coming to see us because irregular periods is the only problem, then we aim to restore that. And the easiest way to do that is to start the patient on hormonal tablets. And when you see the doctor will do a risk assessment and prescribe you the appropriate hormonal tablets. The second presenting complaint may be acne or oily skin or loss of hair. And again, the treatment for this will be to restore the hormonal balance is to give you hormonal tablets. Again, this has to be based on a risk assessment undertaken by a qualified medical practitioner. The third presenting complaint may be hirsutism, which is abnormal hair growth in the upper lip, chin, etc. And again, this is to restore the hormonal balance to be undertaken by a qualified doctor. If fertility is the problem, then we have to address this issue by giving medications to help the ovary make an egg. And the response of these medications to help the body make an egg is better with a normal body mass index. So in a gist, polycystic ovarian syndrome gives you a variety of symptoms, and management depends upon the symptoms you present with. However, the recommendation for anybody presenting with any problem with polycystic ovarian syndrome is three-pronged. One is to get the body mass index down to less than 20, between 23 to 25. The second is to adopt aerobic exercises. And the third is to take medications, hormonal tablets, plus insulin sensitizing medications like metformin. But all of these medications have to be taken under the influence of or under prescription by a qualified medical practitioner. So I hope this has thrown some light into what PCOS is, what the problems causing hormonal imbalance is, what symptoms they can cause, and what the treatment options are. One another thing I would like to stress here is that as to the need for treatment, untreated polycystic ovarian syndrome cause lots of problems. One is the body weight gets really out of control, and it's like any other problem. It is always easy to deal with in the initial stages. So do see a doctor. Ignoring the problem or living with the problem is not an option for a healthy lifestyle in women with polycystic ovarian syndrome. And again, untreated polycystic ovarian syndrome is known to cause long-term life effects like developing diabetes, developing hypertension, and developing heart diseases very early on in life. So treatments are easily available, easily practically possible. So please do not ignore the problem. See a doctor, follow the advice, maintain your body mass index, exercise regularly, adopt the necessary dietary changes in order to live a happy, healthy life. Best wishes to all of you.